Hi and welcome back to my channel. Today I'm bringing you a bit of a different video. Today I'm going to try a reaction video. So I'll actually watch some TikTok videos with you and I'll show you my reaction. I think that this is a different move for the channel, but that it might be fun. I hope you like it. If you're new to the channel, my name is Sérgio. I'm an acupuncturist with over 10 years of experience, both working in the clinic and teaching advanced acupuncture courses. As I said, I'm going to be reacting to some health-related TikToks and giving you my opinions as an acupuncturist. I'll try and keep it fun, try and keep it all in good spirits and good fun, and try to give you some good advices that I can take away from the videos. So I hope you like it, and let's dive in with the first video. This is a video for subscapular pain. Oh, and we're going to learn an exercise. Oh. Okay, so that's interesting. Well, subscapular pain is something that we see a lot in the clinic, and usually it comes from muscle knots or contractures. And in fact, stretching can relieve some of the tension. With the stretch that he's showing, I think that you'll probably be able not just to stretch the muscle, but also to induce some movement of the scapula, which will definitely help. But unfortunately, in my experience, in most cases where you actually have contractures along the scapula or subscapular, so under the scapula, just as stretching exercise won't be enough to solve it. It might give you some relief for a few hours, but you're probably going to need more help than that. I actually have a video on muscle knots that you can check out. I'm going to put a card here so you can check it. But with balanced method acupuncture, we get great results on relieving most kind of muscle knots and contractures. And in most cases, within 1 or 2 sessions, you can have those contractures solved, and so say goodbye to your subscapular pain. But if you can't go to the acupuncture that day, if you're suffering with pain, for sure I'd advise you to try this exercise, and I'm fairly certain that it might help, and if not solve the problem, at least give you some relief so you can be more comfortable until you can actually get a more permanent solution for the contractures or the muscle knots. Also, if you're suffering from recurrent contractures in that area, it's probably one of 2 things. Either bad posture, which is very common for us today, especially because of the cell phones, but it can also be related to over-exercising. So maybe you need to review what kind of movements you're doing with your arms, maybe strengthen your back and the muscles around the scapula so you can stop overworking them and getting those contractions. But all in all, I think this is a great video, and I would follow this advice if I had this pain and I couldn't get to a higher degree of care in that situation. So for sure, if you're feeling this kind of pain, try this exercise, it might help you. And let's watch another one.
If you suffer from low back pain or sciatic pain, I have a miracle for you. Please stick around and watch this video.
Okay, right now I'm already a bit bothered by this video because this is a problem that a lot of people in health industry likes to overemphasize the results, and every time I hear this miracle, this magic, that, I get worried because I think there's a chance it might be overselling or overstating, but let's let the man speak and see what he brings us.
Lightly, and I know it sounds like I'm going to try to sell you something. I'm not. This is free.
So not selling
Now
us?
the thing I'm going to teach in this video is especially valuable to body workers, chiropractic doctors, physical therapists, massage therapists, and the like.
Okay, so he's giving advice to massage therapists, to physiotherapists, well, this might be great. It might also come off a bit conceited that you're giving advice of treatment to someone who specializes in that treatment, but again, that's part of what I do in this channel. I try just to talk about my area of specialty, which is acupuncture, but let's see what our friend has to say.
Are going to find that this is of great benefit, but any doctor can and should, in my opinion,
Doctor.
learn about this and use it. It's very simple.
Not convinced
and it's
yet.
extremely effective, and it can be absolutely miraculous.
Again,
and you can
miraculous
use it on yourself as well if you are one of those people who have low back pain or sciatic pain.
Even do it on ourselves.
I'm not talking about temporary relief. In most cases, this can help to make it go away permanently.
So again, I'm highly skeptical of what's going to come from this video. So it's a miracle, then you can do it on yourself, and then it can, in most cases, solve permanently the problem and not just help you to handle some of the symptoms. Well, a lot of patients with back pain have herniated discs. They might have other problems with the spine. They might have injuries, not just on the spine, but on the muscles around the lower back. I see a lot of patients with back pain, especially if it's back pain with sciatica. Something is inflaming the sciatic nerve. So I know I haven't seen what he's selling yet, but for now I'm not convinced. I hope that he's going to surprise me, because I see a lot of lower back pain and sciatica patients. I've done a lot of courses, I've read a lot of books studying the best ways to treat this problem, because it's very common and I don't get 100% results. Most of the times, even if we get great results, and acupuncture, in my opinion, is one of the main resources to deal with lower back pain and with sciatica. If there's a hernia or an injury, especially to the spine, the problem always comes back, so the patient needs to do some maintenance. So I'm very skeptical, but very curious to see what this trick is going to be.
This is something I discovered many years ago. I've used it on countless patients. It's a big world, and surely there's someone else in the world who knows about this, but I don't know of them. I've never read it in any book. It was never taught to me. I've never heard about it. I've never encountered anyone who knows about it. So, for lack of a better name, I call it the Curtis technique.
The Curtis
technique is easy to do.
Humble.
It doesn't take a lot of experience or practice. And the results, you won't believe the results. They can be absolutely dramatic.
I'm already not believing the video, but let's see.
95% of the time. There is that small percentage of patients that I haven't been able to help with this.
Did he say 95% of the time?
Most of the time it works. It can be absolutely dramatic. It works probably 95% of the time.
Oh,
there is that small percentage of patients that I haven't been able to help with this.
I really hope I'm wrong, but
most
Dr.
of the time
Curtis,
it works very well, and in
not convinced.
most cases it's dramatic, and the results can be seen immediately. In some cases,
immediate results too, so
the pain
it's
goes away
something akin to acupuncture.
immediately. And as I said, it's permanent.
And permanent.
I haven't really
Dr. Curtis,
found any limitations.
stop
to
teasing,
this
just let me know what
technique.
it is.
I've had patients who have multiple disc herniations confirmed by MRIs, and yet they still respond to this.
Okay, watch that he says multiple patients with herniated discs confirm that they respond to this, not that he solves it with this. But again, I'm thinking that this is a bit too much of an upset.
I even had a patient who had had 2 failed spinal surgeries.
2 failed spinal
He was on
surgeries.
disability, and this technique worked on him. Now, he wasn't one of those patients who immediately got well. It took time, and it took multiple sessions, and I taught his wife how to do it, and she did it on him at home.
I thought you
and
said
he
we
was
could
able
do
to
it
get
on
off his
ourselves.
pain medications, and he was able to live a normal life. Many of the people I treated with this technique had had cortisone injections. They'd gone through physical therapy.
Okay,
they'd had chiropractic
let us see it
treatments.
then, Dr.
They
Curtis.
had, and many of them had gone to acupuncturists. Nothing helped. I've had patients.
Oh, wow, this one hurt deep, so this is better than acupuncture. Now I'm really curious to see it. I think that Dr. Curtis knew that I was going to make this video, so he made this specially to sting me. Pun not intended, but stinging an acupuncturist is not a thing you want to do. I'm sorry.
Who had sciatic pain for decades and just had to learn to live with it. Now, I'm not boasting. I just want you to understand.
Well, you're boasting a little bit.
It really works, and it's a free gift. I'm not trying to make any money off this. I just want to give this to the world. I want the knowledge of this thing to spread.
And I'm keen to receive it. Let's go.
It's unusual. It will seem very strange to you. Some of you will reject it because of that. There are people who simply refuse to accept anything that doesn't make sense to them. It doesn't make sense to me either. It didn't make sense.
I prefer it to make sense, but if it works, I'll accept it, I promise.
I've used it for decades and it works.
We've been using it for decades and nobody else is using it? No. See, this is another problem I have with this amazing solutions that work 95% of the time, even with herniations, and then he's been using it for decades, but he's telling us about it on a TikTok. Didn't he tell everybody else? Why isn't everybody else doing it? Again, I'm skeptical. Dr. Curtis, let us see the trick, please.
I don't expect you to not be skeptical. I would be skeptical too. That's a scientific approach.
Yes, it is.
What I call open-minded skepticism.
Yes, that's what I have.
But I do hope you will try it. So,
let's see.
First, you have to find the spot, the Curtis spot.
Okay, so the Curtis.
Right into the armpit, and then go down maybe 4 inches, and then push around, press around. You will find a sore spot. In fact, I would always tell patients, there's going to be a sore spot down here. Tell me when I find it.
Okay, I'm going to stop this now. So what Dr. Curtis found out was, I'm guessing by the location he's palpating, he discovered heart 1, which is an acupuncture point belonging to the heart meridian. And it can in fact help for a very specific case of back pain with sciatica. If you know the balance method, you know that the heart meridian will treat both the gallbladder and the kidney meridians. So I would say that the kidney meridians usually work with, or the kidney meridian can help when you balance it using the heart, for instance. It will help with muscles that are very close to the spine. And the gallbladder meridian is usually responsible for sciatica that goes along the side of the leg, like it's the sew line of the pants. So yes, this point can help, but I'm sorry, I don't believe that you're solving 95% of the cases just with this, for a few reasons. Although this is actually a good point for back pain, in my opinion, there are better points. Again, I can show you here a video I have about back pain and sciatica where you see my approach, but the reason that I'm not trusting this heart 1 technique so much is, first, when you just do acupressure, you can never get as good a result as you would with actual acupuncture, so with an acupuncture needle on it. And the results he's talking about are better than the results that I know that any acupuncturist gets, regardless of if he's using master tongue, using balance method, which in my opinion are the best techniques for lower back pain. So I'm not buying it. Also, the kind of sciatica and lower back pain that heart 1 would be good to solve is not the most common one. The most common cases of lower back pain come from the bladder meridian, which is not treated by the heart. So I'm sorry, Dr. Curtis, I'm going to remain skeptical of your solution. I'm sure it will help in some cases. I'm very skeptical of the 95% solution rate, and I'm even more skeptical of the long-lasting results of a technique like this, because usually acupressure doesn't have very long-lasting results, or else nobody else would be using needles. We just press on the points. So this one is a pass for me. Not going to say he's wrong, but I'm going to say I think he's overblowing his results by a lot. And given this, I'm not trying to say anything bad about Dr. Curtis. I don't know him. This is just my professional opinion on the technique that he's showing. So let's keep going and watch another video on back pain. Okay, so this is an exercise for lower back pain. Okay, first of all, mobility exercises are actually good for lower back pain, but there's a big problem, which is a lot of the patients that I see when they come for lower back pain, the pain is already so strong that they can't do the mobility exercises because the pain doesn't allow them to move like that because it's too painful. So this is good, but if it's actually, let's see all the exercises you're going to show, but this might be good for milder back pain, or maybe to prevent back pain when you feel that your back is feeling a bit more sore, more stiff. But if you're already in the middle of a lower back pain crisis, I doubt that you could do a lot of movement exercises. But this first one, I agree with. Let's see. Oh, wow, he has amazing mobility. I'm sure that he does yoga or maybe Pilates. Okay. Oh, he's going to twist now. Yeah. Oh, wow. Well, first of all, most regular people don't have the range of motion that this gentleman has, Dr. Son, I believe. These are good exercises within limits, in my opinion. First, as I said in the beginning, if you have a real lower back pain crisis, you won't be able to do these moves. And there's another thing that's worrying me, which is if you have a herniated disc, doing a movement which is with this much range, twisting your spine, might actually make it worse. So I'm going to say that I like this video for a healthy person that's starting to feel their back getting stiff, but if you have actual back problems, you're probably going to need to see a doctor, an acupuncturist, maybe both, see what's wrong with your spine. Acupuncture is a great strategy to treat the back pain, but also consult a neurosurgeon, see if you have herniations, and if you have them, you're probably not going to be able to do these exercises safely. So this is a problem with these very quick videos advising quick fixes for problems, which is they're fine for some people, but for others they might not be safe. So you need to be careful when getting your medical information from TikTok or YouTube. And I advise you to do the same with my videos. Don't blindly trust them. Most of what I try to teach here is directed at other acupuncture professionals, but especially if you're not a professional, don't just follow my advice. Try to learn from what I teach, but always check it up with your health professionals. Okay, now we have a Joe Rogan video.
But then there's also injuries.
Okay, here he's talking about UFC fighters.
So many of these guys are fighting with up backs, up knees, and up elbows, up hands, and you don't know that when you see them because they look jacked and they look ripped. Right. In their head, they know.
Yeah, this is a very common problem with athletes. I work a lot with athletes and in particular with martial artists, a lot with kickboxers and with Brazilian Jiu-Jitsu fighters. And the two things that Joe Rogan is saying are very true. First, that they get injured a lot because of training, because of overtraining, because of accidents during sparring. And also that a lot of times they have to go to fights or go to events and they are already injured before the event starts.
I gotta be careful if I move to the side on my right side.
Yeah, and that will make them not trust some of their movements. Maybe some of the things they usually do, they can't do because they know it's going to hurt or worsen the injury.
Because my knee,
I know all about that.
I got to be careful if I get kicked in the legs because this is. I got to be. Yeah.
Yeah, this is a very common problem. And what I will say to everyone who is a serious athlete or wants to be a serious athlete, regardless of if it's combat sports or any other kind of sport, but especially if it's combat sports, because they are very injury prone, and small injuries because you got hit here, you twisted your ankle, you twisted your shoulder, is find a good acupuncturist who knows how to work with athletes, because this will change your career. With acupuncture, we can improve a lot of the injuries that you're already bringing. We can make them hurt less. We can give you back some of the range of motion, in some cases all the range of motion. And even in the most extreme cases where maybe you got hurt during a fight camp and you really need to fight, this of course is not the healthiest thing, but we know that sometimes athletes have to do that. An acupuncturist might be able to put you back in fighting shape, even if it's just for that fight, and then you have to stop and do a full recovery for the injury. But acupuncture is an amazing resource for injuries and to help you keep your body as healthy as possible during a fight camp. Well, I'm saying acupuncture, but acupuncture, cupping, and moxibustion, in my opinion, are the holy trinity of athlete care. And with it, we can do amazing things, and not just help you with current injuries, but we can help you prevent future injuries, and we can actually improve your performance, not just by the injuries part, but by giving you back some of the mobility you might have lost, helping you recover faster from training. So if you are an elite athlete or you want to be a serious athlete, I advise you to try and find a good acupuncturist to help you. This is as important as it is to find a good trainer or a good physiotherapist. And more athletes are starting to work with acupuncturists because the results are there and they are undeniable. And this was it for today. I hope you've had some fun. I hope you find that this was not just entertaining, but also educational, that you learned something from me. If you just found my channel because you don't usually follow this kind of content, check out the rest of the videos. I have a lot of videos on different topics, more related to acupuncture theory, more related to clinical cases, so check them out. And don't forget to like and subscribe to the channel, and I'll see you in the next one.